to another one of Willo webinars, our virtual lunch and learn. So some of you already know me. My name is Maggie Wen, and I'm the manager of clinical education at Willo. So I'm your host today, and we have some really amazing panelists that we'll be introducing in just a minute. So I know that many of you already know me. I'm a registered general hygienist myself, and before joining Willo, I was faculty at the University of British Columbia for 6 years. So just to tell everyone a little bit about Willo first, because I know that we also have some new faces today. So what is Willo? Willo is a robot. So Willo is a robot that brushes your teeth. Willo is really a brand new way, a brand new approach to oral hygiene. So as dental hygienists, we all know that people don't brush well, and people don't brush well consistently, right? Because we see all the clients out there, all the patients, all the clients, and we know that when they come in, even though they tell you, hey, I've been brushing twice a day, you still see a lot of oral hygiene issues they have. So what Willo does is an oral care robot that brushes your teeth for you, eliminating any chance of human error that is there. So designed as an automated pressure control cycles that provide deep adaptive brushing, Willo does a personalized oral care for everyone. So our goal really that it's bringing perfect oral hygiene for everybody. So think of it like a Roomba for your mouth. And I'm just gonna show you a photo, a close-up photo what Willo looks like. And you can also see in my background actually is a Willo unit. So this is Willo. So it has a few pieces comes together. So first of all, Willo has a number of pumps and valves that is in action when you turn it on. So what happens is that this is the water tank, and the one on the right hand side is liquid toothpaste. So what we do is when you put this piece in your mouth, as you can see perhaps a little more clearly over here, this is the mouthpiece. So it comes in 3 to 4 different sizes to adapt for different anatomy. It is soft, made of silicone, which is also biocompatible. And it is also, because the soft texture of it, it also be adapting to the different anatomy that we have. And these are nylon bristles attached to the silicone. So when you press the button, put it in your mouth, the bristles will be doing a series of contraction and relaxation motions, which is what's the mechanism that's brushing your teeth and doing oral hygiene for you. There is a hose, you can't see it in the photo, but there's a hose behind it that actually sucks out all the wastewater too. So think about perhaps little kids who can't swallow very well. Think about your older adults who may have trouble swallowing. All of that, you don't have to worry about them spitting at all, because the wastewater tube will just suck out all the gray water. And 2 minutes per cycle. So when you are finished with the top, what you have to do is flip it over and do your bottom arch. And we actually have an adaptive brushing feature as well. So depending on how long the last time you brushed, we'll actually adapt the cycle to fit you as well. So it's a truly smart device for everyone. We're very excited because Willo will be launching in late June. So first 1,000 units will go then, and then will be fully available commercially towards the end of summer. So Willo is very excited to be meeting everyone very, very soon. Yeah, so aside from that, let's just dive straight into the panel discussion. So the reason we're doing this is because we know that during this current time, right, and perhaps more than ever, we want to be a quality source of information and also be a support community for all the dental professionals that's out there, especially dental hygiene. We don't want to just be, just another oral care company out there. We wanted to make sure that we stay very close to you and we offer any support that we can during this time. So in the past 2 months, we actually offered a number of webinars. We did ergonomics, we did clinical management of caries. So for anyone who haven't seen the webinars before, we'll make sure to send that to you. So and today, we bring to you guys this very exciting webinar on dental hygiene and alternative careers. So let me just introduce to you very quickly, and perhaps if you could see our wonderful panelists on video, have them wave at you as well. So we have Jill Rethman, who is a past ADHA president and the current ADHA delegate to the International Federation of Dental Hygienists. So she's also the editor-in-chief of Dimensions of Dental Hygiene. I'm sure many of you have read this really great publication. Jill presented at educational programs globally and is currently adjunct faculty at University of Pittsburgh and also Ohio State University. And her latest obsession is trying to break her personal record on her Peloton bike. So hi, Jill. We're very excited to have you here. Welcome. And next up, we have Trinity Cleveland. Trinity has some really amazing education and work experiences, super interesting. So after 20 years of being a clinical hygienist, she decided to pursue a master's degree in healthcare innovation at Arizona State University. She now works as a consultant, as also analyst with Mercer Government Human Services Consulting. So welcome, Trinity. She'll be telling us some really cool stories, including how she got her current role, even though that's predominantly for nurses in the past. So I'm very excited to hear about Trinity's experiences.
Thank you so much, Maggie. I'm glad to be here.
Thank you. Welcome. And last but not least, Melissa Gardinetti. So I am super happy for Melissa to be here because we go way back. So Melissa completed her diploma in dental hygiene, and after that, she earned a Bachelor of Dental Science from UBC, the University of British Columbia. So this is where Melissa and I first crossed paths. We were both faculty at the same time. So at the time, we're kind of like a pair of new kids on the block, but we figured it out. We both stayed for quite a while. And Melissa practiced for 12 years full-time as a hygienist while still, able to commit to the teaching at the same time. And after that, so about 3 years ago, Melissa decided to transition out of clinical practice, and she's never looked back. She's now the territory manager for Nobel Biocare, which, as we all know, is a pioneer and really a leading company in the implant industry. So welcome, Melissa. We're very happy to have you.
Thank you, Maggie. Thank you for including me. I'm very happy to be part of this.
All right. So a few housekeeping duties before we go into a full-on panel discussion. So the questions will start with, before setting up this panel discussion, actually through email and through Facebook, I had engaged with many of you that's listening right now regarding what some of the questions that perhaps you wanted to ask. So we'll start with a number of questions that what I see as common themes in this. And once we go over these questions, we'll open the floor up for live Q&A. So if you have a burning question, don't worry, we'll give you the opportunity to ask. And we'll have some closing remarks at the end. So without further ado, let's jump into the very first question, which is, what do you do in your current role? So we know that, we talked about your titles, we talked about experiences, but what's your day like? What's your job actually about? So perhaps Jill could start first.
Sure, and yes, thanks, Maggie, and thank you to Willo for having this webinar. I think this is a topic that's of high interest to a lot of dental hygienists out there right now. What I typically do, my typical day as it relates to dimensions of dental hygiene, I'd say most of my job duties center around editing articles. And so any article that is published within the journal is edited numerous times, but a final edit goes through me. And so that's a painstaking process. It requires a lot of reading, obviously, a lot of attention to detail. And so I do that. That's the bulk of my time that I spend working on behalf of Dimensions. Another thing that I do is every month I write an editor's memo. And I have to tell you, some months it's very easy to come up with a topic. Other months it's very difficult to try and think of something that's new and different. But that's the other part of the duties that I perform as editor-in-chief. And then when we're back to normal, hopefully that'll happen sometime soon, I represent Dimensions of Dental Hygiene, mostly at the ADHA annual conference. We have a booth there. We do every year. Very strong supporters of, obviously, that particular organization. in that meeting. And so that's part of what I do too, is interacting with our readers, interacting with people who come up to the booth and just have random questions about the publication. A lot of the questions that I get are, how do I write an article and how do I get started with writing? And so we're there to help with that. And I always enjoy talking to hygienists who are interested in writing, and trying to give them a little bit of help along the way. So I think in a nutshell, that's pretty much what I do.
Oh, that's very interesting. Because I know many of us have read Dimensions of Dental Hygiene at some point. So it's really cool to hear the inner working, and perhaps to know that being a hygienist, this has been a really rewarding experience for you. So
Absolutely.
Yeah. And so Trinity, how about yourself? Like, what do you do in your like at a day-to-day basis? What's your day like? What's your job like?
Yeah, thanks, Maggie. I mean, I get asked this question a lot, and I keep hoping that every time I try and answer it, I'm able to answer it a little bit more clearly, articulated a little bit better, because it really changes daily. But primarily, what I do is I work with state Medicaid agencies and helping them find ways to maximize the money that they spend on high quality physical and behavioral health care for their beneficiaries, for the Medicaid population in their states. We do external quality reviews of their contracted health plans. So it's looking really into, are they meeting contractual requirements and meeting or exceeding federal regulations around quality, especially when it comes to how they are caring for providing opportunity for access to care for their populations. My days usually revolve a lot around doing research, finding evidence-based practices for things like value-based payments, which is like pay for performance, so pay for quality versus pay for volume opportunities. I am helping the states to develop policy that supports changes. And we do a lot of review of data to look at where gaps might be in their policy or in their contracts, and looking for opportunities for improvement. So I work a lot with, it's so many different people. I didn't even know that there were job roles for these, actuaries or data analysts who, are really digging deep into looking at the connections between what different data sets tell us, and then finding ways to translate that into actionable items for the Medicaid agencies.
So would you say most of your clients are other insurance companies, or are they more patients?
My direct clients are state Medicaid agencies.
I see.
So whoever is administering the or managing the Medicaid health plans from a state level, that's typically who I work with.
See. So you would probably say that you're still very much within the healthcare space, but it's more of a global.
Correct. I've got that like 50,000 foot view of what's going on, and so by helping the state Medicaid agencies to find better ways of providing care, or to support the care that's being provided by using their money better, then it eventually it trickles down from the managerial part of it, through the health plan part of it, to the providers, and ultimately to the beneficiaries.
I see. So you're definitely making an impact to the healthcare space, but perhaps without being in a clinic every day. That's very interesting. Thank you. Yeah. Thank you. And how about you, Melissa? What do you do on a daily basis? And what's your role like?
So as Maggie said, I am a territory manager for Nobel Biocare. What does that mean? Well, it's a primarily sales-based role. However, it's really more of a consultative role. So I help the doctors, the practices I work with, develop their business plans. How do they want to grow their business? What services with respect to implants do they want to offer their patients? How can I support them to help generate referrals? So within all of those conversations, there's many pathways that, it could branch out to. So it's about developing events. We have something called a TEM where we invite referring doctors. I help organize those. I help, like I said, develop the educational pathways. So if a doctor wants to go from placing single implants to doing a more complicated procedure like all-on-4, certainly that requires a lot of education and some experience. And so based on how the doctor wants to navigate that pathway, I have that consultative approach to really tailor that plan. Like I said, the role is primarily sales-based. So combined with all of this, there's also the matter of helping the doctor make sure their inventory is where it needs to be. Staff can be a revolving door, so working with their assistants or office managers to make sure they're on top of the online ordering process. And then of course there's returns, exchanges, lots of different things. And what that looks like day to day can definitely be like this. Basically, it's a lot of phone calls, emails, visiting offices. Obviously, during COVID, that's very much slowed down, but BC is in phase 2. And so with the proper protocols and maintaining social distancing, I've actually started going back into dental offices. This afternoon, I'm training a brand new it's 2 surgical assistants, and they just got a new implant motor. So I'm going to be training them on how to operate that. But yeah, so very different from, you know, scale, prophy, floss, you know, probe, time for an exam. But at the same time, what's similar is that you really need to be on top of everything and mindful of your schedule. So it's dynamic. That's how I like to call this role, a dynamic role.
Well, that's really cool, right? So it almost sounds like you're still very much interacting very closely with doctors, with different components of the office. But
and I love that. Yeah.
That's really cool, because I think a lot of people, when they transition out of clinical practice, they say they miss the day-to-day, the human contact. So
absolutely,
sounds like you're able to maintain that.
Yeah,
that's wonderful.
Yeah, going into the offices and seeing the hygienists and the assistants and the office managers and of course the doctors. You know, all offices, although they're different, there's a lot of similarities in them. And having been a hygienist, I just feel like I'm a part of the team in a lot of ways.
That's wonderful, Melissa. Thank you.
Thanks.
All right. So I think this makes the next question very natural to be very much the next question, which is, I know that for all of us to make that decision, right? What initially made you decide to step away from clinical practice? Was there one single event? Have you always been thinking about it? Did life kind of take you there? So what made you decide to step away from clinical practice and transition into something else? Perhaps we could start with Jill again and tell us a little bit about how it all happened.
That's a really good question. For me, it was a gradual progression. So in other words, it wasn't one thing that happened where all of a sudden I said, okay, I think I want to step away from the operatory now and do something different. I really enjoyed patient interaction. For me, that's the most rewarding part of a clinical dental hygiene position, is that you get to know your patients and you see them over and over again. You get to help them improve their oral and overall health. And so that part I really enjoyed, but I just felt, I got to a point where I felt like I wanted to diversify. And so initially what happened was I continued, of course, I started out of school, full-time clinical practice. So then what happened when I decided to diversify into something else is I would be part-time clinical practice. And then I started working at dental conventions for a dental products company. And so that would take me across the country, traveling, working with other dental hygienists. From that position, then I learned of another position where I would be doing something similar, but managing other hygienists to do that. So one position led to another. From there, I heard of a position where I would actually be doing continuing education programs, lunch and learn type programs. So I got involved with that. Then I heard of another position, a different company. So you can see how they're building blocks. One thing leads to another. I heard of a position where I would manage other hygienists to do educational programs. And then along the way, I started writing, contributing to different publications. And that's how the position to become editor-in-chief of Dimensions of Dental Hygiene came along. This is a really tight timeline here that I've described because it took place obviously over several years. But I think for me, the reason I decided to diversify and to go and do something different is I come from a family of entrepreneurs. I don't have any dental people in my family. Well, other than my husband now. I married a dentist. So, but growing up, I didn't have any dental role models, so to speak. They were all entrepreneurs. So I feel very fortunate that I was able to find dental hygiene as a career and then involve that entrepreneurial spirit along with it. So I just feel so lucky and so fortunate to be a dental hygienist because there's so many opportunities out there. And hopefully that's what you all will come away with after this webinar today.
Yeah, that's I think that's very important for everyone out there to hear because, and I really appreciate how Jill, you talked about what you started out doing and what you gradually built up, because a lot of times when I attend these career type of seminars, I feel like, okay, I get it, you're really good, you're really successful, but how did you get there, right? So it was amazing.
It takes time. It's not something that happens overnight. So be patient.
So there you go, everyone. Make sure you're patient and keep an eye out for opportunities that comes your way. That seems to be the words of wisdom from Jill. And how about Trinity? How did it happen for you? How did you decide to make that decision?
Yeah, so my story is quite a bit different than Jill's. I was in clinical practice full-time for more than 20 years. And ironically, just a couple of years before we made this decision, my husband asked me, he said, hey, we were actually on vacation, and he says, if I were to ever win the lottery, we won and we got the big one, would you keep working? I was like, yeah, of course. I mean, I'm not going to give up patient care. And he went, yeah, I kind of figured that was the case. And so it was kind of just a joke. And then literally less than 2 years after that, I developed several musculoskeletal issues that, were basically going to be career changing for me. So when I finally accepted that, I'm sorry, is there a question?
No, go ahead.
Okay.
No, you're doing great.
Thanks. When I finally kind of accepted that fact that, okay, this is going to look very different in my future. What do I want to be when I grow up? I actually started talking to some of my patients. What do you do? What is your role like? What is, oh, that's interesting. What does that mean? And thinking about like different ways that not only the skills and that I was learning as a hygienist, or that I had learned in the course of my hygiene career and in education, but also just thinking about things that really kind of excited me, like quality improvement, process improvement, those kinds of things. It's the idea of making something really great and doing it in a efficient and effective way. I was like, that's what I want to do. How can I do this in a dental office? And then I started thinking, I think that I can make a bigger impact if I take this to a higher level. And then it's kind of what led me to where I am. I really didn't think about consulting with state Medicaid agencies. That wasn't in my plans. I had no idea that was even an option. But I knew that I wanted to do something with a bigger system, healthcare system. And so rather than having this kind of gradual stepping stones up to that place, kind of took a leap of faith and found this program, the Master's in Healthcare Innovations at ASU, and was like, this is what I want to do. I don't know what I'm going to do with that degree, but I thought, what the heck, it's a degree in innovation. I can do whatever I want with it, right? I'll just make the roll up if that's what needs to happen. So took a step back from hygiene, from clinical care, and was temping quite a bit. while I was in school, and I also had the great opportunity and pleasure to teach for 3 semesters at our local community college, one of them in the dental hygiene program there. That was an amazing experience, but I was still finding myself doing a lot of clinical work and still having a lot of pain at the end of the day. And so pushed forward and finished my degree, and here I am. So it was kind of from the time I made the decision that I needed to do something else to the time I actually started in my new position was 23 months.
Oh,
So
wow. Thank you for sharing. That's I think this is starting to be a bit of a theme, is that I think for everyone that's perhaps out there thinking about transitioning, is that it's not a overnight process, right? For you, from investigating and thinking about what you want to become and eventually getting there. I think for everyone, you're starting to think that this is not a overnight thing, but it perhaps takes a little bit of active soul searching as to what you want to do. Just like you said, what do you want to be when you grow up? And what skills you already have and what interests you? Because I think the same thing happened for me when I first started thinking about transitioning out of clinical practice. I was teaching, I was practicing, and during the time I was doing my master's, I did mine in ergonomics and craniofacial science. So when I did that, during that process, there was quite a bit of soul searching and even writing down what I think my skills are. So I think people, if you're listening right now, I think you can see that this is perhaps a little bit of a reflective process instead of a quick, what am I going to do tomorrow kind of thing. So how about you, Melissa? How was it like for you to transition out? How did you make it?
So just like everybody else, it was kind of a slow process. I will say right out of the gate, though, as a dental hygiene student, I didn't want to limit myself by just having a diploma. While a diploma is excellent and it teaches you the skills to equip you to be a registered dental hygienist, having a degree really gives you that lateral movement and that flexibility. So as a student, I had the mindset that I was definitely going to complete a degree. And so I graduated, worked full time, and then it just got to a point where I wasn't feeling fulfilled. And what does that mean? I mean, so many different reasons. And as a hygienist, I'm sure everybody can relate. We have a lot of time during the day, especially when we're with the patients who don't really want to interact and think about things. Obviously, we're thinking about our probing and accessing those hard to reach areas, interproximal regions, sure. But we're also thinking about, what are we going to have for dinner? What are we going to do after this? What does this person do in their day-to-day life? So I started thinking these questions and having these feelings of, I'm just not feeling fulfilled. I love the people I work with. Obviously, seeing the patients is wonderful. And so it got to a point where I actually took a step back and I reached out to a number of friends who set me up with lunch meetings. So I spoke with someone who was in marketing about what it is they do at their firm. I spoke to someone in medical sales, in pharma sales. How is it they got into it? I spoke to someone in event planning. I spoke to someone in real estate. I spoke to a lot of different people. However, I didn't really feel that sense of, this is me, this is where I belong. So I didn't make a move. I didn't do anything. However, having those conversations on top of all the conversations that you have with the patients, just like Trinity mentioned, what is it that you do? How did you get to your role? How has your career progressed? It really just kind of gave me insight that even though I define myself as a dental hygienist, I have all of these skills, like you were mentioning, and these skills are transferable and very valuable to a number of different roles. So I tightened up my LinkedIn profile. I added a whole bunch of extra content, made sure I didn't miss out any volunteerism, any sort of thing that would be valuable. And I just waited. And then one day I was on my lunch break and I got an email from someone who was looking to hire. And sure, we're on LinkedIn. We all get those all the time. But this was something that spoke to me. So one call led to another call, led to a flight out to have an interview, followed by another interview. And the next thing I knew, you give your 2 weeks notice and you finally made that change. But just like everybody said, it is a slow change. So, I mean, it took 2.5 years for this whole story to actually play out. And as you know, I also taught at UBC with you. I explored that, but I just really wanted something that I felt very fulfilled with, that felt like it was a good fit for me. And so, you explore your options, you become clear on what it is you want in terms of a few things, and then you wait, and it'll come.
Thank you, Melissa. That's some really amazing insight. And I hope for everyone that's listening, you can see that you sometimes need patience. You need to think about what skills you have, and waiting for the right moment, and being able to identify the right opportunities for you seems like key. So I think this really leads us to the next point, which is, what was it like taking this leap? Was it scary? Was it exciting? Did anybody or anything or you have has really helped you through this transitional period? Perhaps Jill could start with that.
Well, actually, you hit the nail on the head with the 2 words that you used: scary and exciting at the same time. Also fulfilling, though, I would include that, because as I said, I had been looking for ways to diversify, and when I found all these various opportunities that were out there, because of the fact that I was a dental hygienist, it just really fell into place. I saw a question that just popped up, and the question had to do with, can we tell people about what the employment opportunities are? And I would answer that, it actually falls in line with this question that's on the screen. I would answer that by saying, before you do that, and Melissa hit on it perfectly, find out what excites you and what your passion is. You need to look for that area within dental hygiene or within corporate or whatever it is that you think you might want to do, that keeps you looking forward to getting up each day and doing your job. You have to identify that first before you go and start reaching out to the different entities that you think you may want to be affiliated with. For me, it was the writing. It was the writing and the speaking. And I have to say, when I got into speaking, it was the most scary thing that I'd ever done in my life, because I was the person in school who would literally get sick if I had to get up in front of the class and give a speech. That was me. So if you had told me when I was in dental hygiene school that I would be speaking in front of crowds of people, I would have laughed in your face, because that's the last thing in the world I thought I'd ever do. But eventually I realized if I kept fighting through that fear, that I would get to the point where I would enjoy what I was doing and thoroughly do. So it is a leap. In a lot of ways, it's a leap of faith. You need to have people around you who support you, who want the best for you. I think that's also very important. So don't be afraid to do it. It's probably going to be a gradual process, as you've heard from all of us, but don't be afraid to take the leap.
Thank you, Jill. I think that don't be afraid message is so important and so encouraging to many of us as hearing that, and perhaps have gone through a similar process in the past. So thank you. How about Trinity? How's the transition like?
Yeah, I am actually tempted to just say ditto, because I think that that's kind of a common thing that most of us could say. For me, in thinking about it, I think honestly at the time, to be completely frank with you, the scariest part for me was the financial commitment, and I think that is a really big elephant, in the room a lot of times, is, am I going to make as much as I do in clinical hygiene, because it's typically a pretty well-paid position. And not only that, but how am I going to finance my education in order to get me to where I want to be? at that same time, actually less than a month after I got my acceptance letter to the program I had applied to, my husband's company folded. So all of a sudden he's going through a complete transition in careers also. He had been a business owner for 20 years and it, suddenly closed. And so that was probably, blessing in disguise in a lot of ways, but it was also, I think, helped us too, because, Jill mentioned about having just a great support team. Well, we really relied on each other quite a bit to support each other emotionally and obviously financially. And, we really just kind of had to think about what do I want this final outcome to be? What might it look like? Even if I don't know exactly where I'm going, like when I went to dental hygiene, I knew exactly, I'm going to go to dental hygiene school, I'm going to be a dental hygienist. This new step, there was no real clear answer to that question. And so, but I had to look at, here's some possibilities of things that interest me. And I would be very happy doing any one of these things. And they, some of them pay a little bit more, some of them pay a little bit less. I also had to think about things a little bit differently as far as reimbursement or, how that looked, because never thought that I would get, for instance, during my first year on the job, several weeks of paid time off, bereavement pay, sick time in addition to PTO, or in addition to like vacation time, or, all these paid times for volunteer work, so many other different benefits, amazing healthcare benefits, retirement planning. I have, anytime I want to pick up a phone and talk to, a financial advisor, I have that at my fingertips. I have pet insurance if I wanted to, all of those things kind of add in to each other as part of my overall compensation package. And I think that sometimes we get so focused on the per hour rate that we don't, it's scary to think about how other things play out. And for me, it's been very financially rewarding so far. So one of my biggest fears was that financial piece, and it was an unfounded fear, I can say. So I'm happy about that. But yeah, like Jill said, sometimes, acknowledge the fear, acknowledge it, that's fine, experience it, but just know that if you put your work into it, it's going to pay out in the long run.
Thank you, Trinity, and I'm really glad you're being transparent about the financial aspect of it, because one question, and I see them coming up in the Q&A right now, is that, is this transition going to be financially rewarding? Is it going to be worth it for me? So hearing that it is quite possible, to be making income that's financially rewarding outside of clinical practice, I think is very important for a lot of people to hear. And of course, you also have to think about your sick pay, your vacation pay, your 401k, your RSP in the Canadian places, right? All of these are part of the package as well that we don't necessarily get as clinicians. So that's something to keep in mind about. And how about Melissa? What was it like taking the leap?
So first and foremost, we're launching off of an amazing career, right? Dental hygiene. The nice thing is you can always come back. Keep your license, make sure you've got your practice hours. And if it doesn't work out, you have that in your mind, you can come back to it. I don't think there is one doctor who will not take a hygienist that he enjoyed working with back. There's always, a few hours here and there, and the patient load is hopefully always increasing. So you can always come back to it. It's really a very low risk transition from being a clinical hygienist to whatever you're branching out to. Just like everybody else said, it's obviously scary. We come from a very regimented day. We know what to expect. Within that, there's different patients that we see which can kind of scare us, or diseases that we have to treat, but it's all very much structured. So, taking a leap out and having to have conversations that you've never had before about something that you've never talked about with people that you've never met, it's just, it's scary. But having that in the back of your mind that you can always come back to dental hygiene clinical practice, you should be confident doing anything. I mean, that's one of the reasons we chose this job. It's secure. You know, you can step in. If you need to take a day off, someone can fill in. There's not going to be a backlog of paperwork. There shouldn't be. They're doing their charts, but that's a joke.
That makes a lot of sense. I think for a lot of people, right, they're thinking perhaps they can step away part-time like that. So knowing that it's possible to always have your clinical option, perhaps to fall back on, is something I think many of us are probably thinking about, and something to keep in mind when you are making that transition. You don't have to put that license aside and not touch it again. It's always there for you if you need it. So that's great.
Absolutely.
Yeah. We're running a little bit short on time, so let's just dive into the next question here. I think my computer is frozen. 1 second. Okay, so this one's about training and education, because this one, I think all of you guys already touched on this a little bit. And we get this question a lot, which is, besides the dental hygiene diploma in Canada, and which would have been the associate degree dental hygiene program in the US, did you receive any additional education training on top? It sounds like all of us did. And did you find having that education a really important piece of your transitioning? So perhaps it's time for a change. We could start with Melissa.
Sure. So I'll keep it short and sweet, because I did take a look at the time there too. So I do have my Bachelor of Dental Science undergraduate degree. However, I will say for a lot of the roles within this side of dentistry, it isn't necessarily required. In the role that I am currently in, it is required. So everybody within the company has a Bachelor of something at least, but a lot of the roles on this side, there's so many dental assistants, dental hygienists, people within dentistry who have, you know, reached out to a rep who came into their office, expressed interest, and then take the leap without having to do anything else. So just have the conversations and see what it is you need to do, if anything, with respect to education to make that change.
Wonderful, thank you. And I think very similar for Trinity, you already mentioned that you had that Master of Healthcare Innovation. So this is actually one of the questions from the Q&A, and I think this is very relevant for you, is what made you choose that particular degree as opposed to something else?
Yeah, so the reason I chose the MHI was because it's a collaborative degree. It's actually housed in ASU's College of Nursing. So I wanted to, again, kind of think more from a systems perspective, and so looking at the curriculum there and the typical students that participate in that program, like in my cohort, I had nurses, nurse practitioners, surge techs. There's a Army helicopter medic. There's people who are looking at like biomedical engineering opportunities. So it's very, very broad. So all of the people that I got to learn with alongside just gave me a really totally different perspective on what the healthcare system looks like in real life. And so that's actually why I chose that one. I will say that I'm the second hygienist to have completed that program, actually the second dental professional to
wow.
Yeah. And I chose ASU because I grew up in Tempe, so it's, you know, Sun Devil for life, I guess. You know, so I guess that was probably the reason for that. I'm not sure if there are any other healthcare innovation programs in the country. I didn't really look. But just as kind of on a side note too, you know, like, is that necessary for me? Looking at the things I wanted to do, some kind of master's degree was necessary for what I wanted to do, whether it was this or public health or education or dental hygiene or whatever it was. The master's is required. I mean, my teammates consist of psychiatrists, psychologists, pharmacists, nurse practitioners, you know, so you're really going to have that higher education. But I would say that if you're looking for something similar, but not, you know, kind of the same, you can also look at different opportunities for certifications and different things. I have a green belt in Lean and Six Sigma, which, you know, helps with the quality improvement and process improvement kind of part of it. So, you know, don't be afraid of taking those small things too. You know, do an online LinkedIn learning course or something to see if it's even something that you enjoy doing, you know, before you before you jump into, you know, a huge master's degree program.
Right, thank you. And I think this echoed really well with, because I, aside from being the host, I'm actually also keeping an eye on the Q&A. And definitely one of the themes I'm starting to see from what you guys are saying and from the questions is that, can I do this? Can I do that? So I think a lot of it is, what's the expression? Ask for forgiveness, not permission. So the idea is that, if you think something is catching your eye, you know, if you like you have your heart in this, we would say, dive into it, explore, learn more. You know, you don't have to perhaps pursue a degree tomorrow, right? You can maybe take a course, you can maybe, you know, try this, explore more about it, see what education, see what certification you need before you go into this. Because I see the comments, there are some things about myofunctional therapy, there are some bunch of other things. So whatever that catches your eye, I think that's the theme here. Whatever catches your eye, whatever you feel like this is something you can put your passion into, we would encourage you to explore that direction. And how about Jill? Did you need to have to take any digital courses or anything like that to do what you do?
Well, for me, again, I was fortunate. A lot of times I was in the right place at the right time. So that said, I think anytime you go and further your education, it's beneficial, regardless of what you do. For me, and of course the times were different then. I know I sound like I'm ancient. I don't feel ancient, but it was different times, and so it wasn't as competitive as far as having to have an advanced degree to get involved in the different things that I did. What I found, and I think this still applies no matter what age, along with the education, networking. Networking is so important because you never know who you'll meet who will be able to help you along the way. And as you could tell from my story, one step led to another step, led to another step. So networking through your national organization is so important. Networking through friends, networking through colleagues, all of that, along with the education, I think comes together so that you'll be able to do and perform effectively in whatever role you decide to pursue.
That makes a lot of sense. Because again, from the Q&A, one of the themes I'm starting to see is where do I even start? Where do I look? So knowing that, just asking your network, right? Whether it's your ADHA, whether it's your local chapter. For Canada, it would be CDHA and our local organizations as well. And perhaps you can branch out and even talk to people that perhaps took the education program you're interested in, or perhaps, you know, ask a sales rep that come to your office, hey, how did you get here? So I think networking, asking around seems, and exploring your options seems just as important as pursuing the degree itself. So that's really great to hear. So, and because we're already talking about job hunt and, you know, looking in the Q&A, I know a lot of people are asking about where to look, how to look. So when it comes to perhaps the job hunt part, do you feel that your years of clinical experience are transferable outside of the clinic? And how did you perhaps pursue your potential employer, your potential boss, that you're fit for this, that you didn't just come from 20 years of tooth scraping, that your experiences are transferable? So perhaps Trinity, you could start first, because I know you competed with, I think, nurses, right, and got to where you are today. So how did that happen?
Yeah, thanks. So yeah, the job posting that I replied to was geared toward nurses or some, you know, behavioral health specialists. But I think they were really looking for somebody with a clinical, like, such as nursing background. When I had the opportunity to speak with them, I tried to highlight, instead of really focusing on the dental hygiene part of it, because people come in, you know, with these preconceived ideas of what a dental hygienist is. I didn't want to perpetuate that thought. So I tried to, instead, I did a lot of research into, okay, when they're talking about this is what they really mean. So for instance, care management or case management to them meant something, you know, as far as from an insurance plan perspective, meant something completely different to me from a clinical perspective. So I tried to identify all those different things to understand it, to be able to link them together. Absolutely, my skills as a hygienist played a very valuable role in being able to get this, but it was about how do I translate translate that so that they can understand just the way I'm trying to understand what it is that they're looking for. I hope that makes sense. But yeah, and I kind of, I again tried to relate it. I mean, I never, kind of said like, oh, well, case management means this to you and we do those kind of things, but it was just, let me give you an example of what that might look like in my world, and help them to see things through that way.
I think that's very important for our audience to hear. So thank you for telling us that. Is perhaps telling them what you do is or like one thing that helped me when I transitioned out is I thought to myself, we bill in minutes, right? Like I think at least in Canada, unit of scaling is 15 minutes. What other professions bill in such times? And I tell myself, lawyers, doctors, like all these really influential positions. So we really should look at ourselves the same way. So we have excellent time management skills. Many of us, I think we all have really good communication skills. So how do you not, right? I think many of us have great communication skills. We have great education skills because we have to explain oral hygiene to people. How many times a day we have to show people how to floss, right? So when you're doing these things, you don't think about the clinical procedures you do, but rather what does that mean on a bigger scale. I think that will be really helpful for your job search. I don't know if Jill would agree with me. What do you think? Like, what skills are transferable?
Yes, I definitely agree with you. And actually, I would say, as a hygienist, you learn so many skills that are so important, no matter what you do in life. Dedication, commitment to goals, attention to detail, being organized. And I'd say for what I've been doing, those are the ones that really pop to the front of my mind, but also being flexible. Flexibility in your day-to-day workload is so important, because one day might not look like the day before. And so those are all the skills I think that as a dental hygienist, you can bring to the table when you approach a potential employer, no matter what the organization, the corporation, or the business might be.
That's very true. And again, I'm seeing from the Q&A, people are asking, and I think what we're saying is truly giving them some ideas. So I'm very glad to see that. How about Melissa? What did you do from clinical practice that you find still very helpful today?
Well, obviously Jill's list hit all of the major points. I will say that when we do see our patients with outstanding treatments in their charts, it is our role to sell that treatment through education. Sales isn't selling something that you don't need. Sales is selling something you do need, at least if you're selling the right thing. So we all have that experience. How many times have we seen, oh, there's an outstanding, DO on the 4-6 or something like that. And so we explain the need for this, and we explain the risk of waiting, and we explain this. And by the end of the appointment, this patient is going to schedule that treatment with the receptionist, and we've sold that treatment. So we also can't devalue the fact that we are a sales position. Obviously, communication, we deal with so many different personality types: the fearful, the apprehensive, the comfortable, the cocky, all of them. And it's our professional responsibility to treat them ethically, to treat them well, to be kind, to respond, and to engage appropriately with all of these different personality types. And we are in their face. I mean, no other job is in someone's face, in someone's personal space. So there's this element of social psychology that we are just learning how to engage with people in very uncomfortable scenarios. And we have to definitely give ourselves the credit and be confident transferring that skill outside of clinical.
Thank you. That truly, I think, struck a chord with me as well, because like you said, we really work with all different populations. We work with people that are nervous coming to the dentist, and we have to convince them to get whatever procedure that's good for them, right? So I think we already have a lot of skills in communication, and perhaps I know some people were out there perhaps uncomfortable with the word sales. When you think about it, a lot of parts of sales is consulting, it's communicating, right? And it's education. So if you think about we already know. I think we can all comfortably and confidently say that we know more than we think, and it's a matter of putting that to use. So thank you guys. We are going to take a few, maybe one or two questions from the Q&A. We already addressed a bunch of these as we went. That's really great. So if anyone has any additional burning questions you want to ask, this is the time. Otherwise, we'll just go into closing remarks. Let's see. I'm just looking at the Q&A right now. So I think one theme, because a lot of these questions are very specific, I'd rather be able to address something that everyone can relate to, right? So I think one theme we see in these questions is, where do I start? Where do I look for these opportunities? Like, did you go on LinkedIn? Did you look at postings from, for example, Oral-B, or, where did you look? So perhaps Jill could tell us a little bit about that. Where are some places you think people could be looking?
Yeah, actually, I think LinkedIn is that's a good source. Of course, when I was out there transitioning from clinical practice, there wasn't a LinkedIn, there wasn't a Facebook, there weren't any of those things. So in some ways, it's a little bit easier now to get your information out there quickly. I'll go back to what I said earlier, though. Identify what your passion is first. Determine if you need to go on and get an advanced degree. I mean, if you want to be a researcher, obviously you need, just as an example, you need to go back and further your education. So start with that. Start with what you think you really want to get involved with, and then go from there. But the social media options today are really great, and LinkedIn in particular, that can help you get started, and start with the networking. Find a mentor, find somebody who you can identify with, maybe not necessarily who you agree with on everything else, other than the fact that they have been successful in what they've done, and pick that person's brain. It doesn't have to be one person, more than one. And it doesn't have to be a dental hygienist. It could be, but it could be someone in a different profession who you admire, and find out how they advanced their career and got to the point where they are. So you got to identify what you want to do first. That's the first step.
Thank you. And I think that makes a lot of sense, at least I think for many of you that are listening, asking questions, is you cannot transition for the sake of it. Like, you didn't go dental hygiene school for the sake of it. So it takes some time to think about what motivates you, where your passion lies, I think would be very helpful for your transition. You probably aren't going to be out there looking for job postings today, but truly do some soul searching. Think about what motivates you, what excites you, what do you think is a reasonable next step for you to take, and go from there. How about Trinity? Where would you recommend people look for these positions? Like, when you look for your position, where did you find that? Like, did you go on their website? Did you go on LinkedIn?
Yeah,
what did you do?
First of all, the easy answer there is everywhere. Look everywhere. It doesn't hurt to reach out in every direction. The position that I ultimately applied for and got was forwarded to me via email from somebody, one of my colleagues, who said, "Hey, Trinity, I think you'd be great in this position. You should look into it." And I'm like, "Are you sure? Because it says nursing." And she said, "Really, do this." And I did. So it was just about talking with other people about what I wanted to do, what my kind of goals were or ideas were, and somebody who knew my skill set and pointed it out to me.
Thank you. That's great. Again, the power of networking. Actually, somebody commented that maybe online dating is a place to start. Why not? Whatever network you can dip into, whoever that you can talk to, take the leap and pick up that phone and talk to them. That's great. How about Melissa? Where did you look?
So,
yeah.
I think just echoing the statements, just have the confidence to engage the people around you in dialogue that doesn't have to do with you and your current role as a hygienist. Engage with them about their story, how did their journey look? Of course, this is if their story or what they look to be interests you. So who's your favorite rep? Everybody has a favorite rep who always comes in, and they look at the person and they think, oh, yeah, you know, that just looks so cool. I just see her speaking so confidently. Or, oh, you know, she's going from office to office. That looks really fun. Or, you know, we go to these big dental conferences and you see some reps here and there, and they just look like they're engaging in this career and this lifestyle that looks appealing to you for whatever reason. Go to those people. Those people are happy to have a conversation with you. Those people are happy to have a coffee with you and to tell you their story. Look, creep on them. Go to their LinkedIn profiles. Just find out what their journey has been. All of this stuff is out there. So you can very easily say, oh, okay, so they did this. 1 + 1 = 2. Let's see what I can do.
Right. Wonderful. Yeah. Right. So I think if you haven't heard anything, if you remember nothing from today's session, network. Great. Okay. So because we're really running tight on time, we're just going to wrap up with something that I think everyone can reflect on. So let's take a look at this. If you or I know for the last hour, you guys shared some really amazing stories. I'm super thankful that we're doing this today, and I really hope that we have become a source of inspiration for the over 100 people that we have online right now. So if you were to reflect on this journey and you say, I have one piece of advice to share with all the dental hygiene colleagues who are out there who want to transition out of a clinical practice, what would it be? Perhaps we can start with Jill.
I would say don't give up. Never give up. Actually, I was fired from my very first clinical dental hygiene job right out of dental hygiene school.
Oh no.
For 1 week. And after that week period, the dentist called me into his office and said, Jill, this isn't working out. I was devastated. And in fact, I was ready to quit dental hygiene altogether. I was dating my now husband at the time, who was in dental school. And he said to me, Jill, don't give up. Never give up. You've worked too hard for this. So if I had quit dental hygiene at that point, who knows where I would have ended up? Hopefully someplace that I would have enjoyed, but I've enjoyed dental hygiene so much, and it's been such an incredible career and opportunity for me. So you'll face some stumbles along the way, some failures, but still just look at those as ways to build up your confidence and to learn from them. I think it's very important. And I love quotes, so I want to leave everybody with one quote that I thought was really pertinent for what we're talking about today. And that is, don't be afraid to start all over again. You may like your new story better. So I want to leave you all with that thought. And if I can ever help anybody at any time, please reach out to me on LinkedIn. I'm there. I'm on Facebook. I'd be happy to help you.
Wow, that's really amazing. I'm going to remember that. And I actually have a very similar story to share. The very first dentist I worked with, about a month in, he said to me, Maggie, why can't you just shut up and clean teeth? Why do you have so many ideas? Why do you always have something to say? And I was just like Joe. I was very devastated to hear that, because I was a new grad. I had ideas, and he told me that in my face. So I'm very glad that, because it's been 10 years since I graduated from dental hygiene school, I'm very glad that I didn't shut up and clean teeth, and I've done a lot more since that. So just like Joe said, don't be afraid, don't give up. Your next story will be better. And with that, how about Trinity? One piece of advice.
Sure. So I think the thing that I kept telling myself is, I have to be willing to take this risk. I've measured out what the consequences may be, and I'm willing to take this risk, whatever that was. Most of the time what I found is what it meant for me really to operationalize that was to invest in myself. Invest in the opportunities and in conversations I had with other people for the purpose of my learning and my understanding, and to invest in myself in, financially in my education or whatever that might look like. But that was what I kept telling myself.
Thank you. So invest in yourself. That's really great to know. And Melissa, how about you? One piece of advice for everyone that's out there.
So it's really going to be about social media. So we all have a social media footprint. We want to make sure that ours is putting our best foot forward. I feel like I'm my elementary school vice principal. Put your best foot forward. If you're reaching out and trying to, move into another industry, and you network and then your name gets passed along, make sure that, when that person or that person's colleague or that person's manager types your name in, you've got a tight LinkedIn profile. You don't have any pictures of you partying in your freshman year. Lots of Americans, we don't have freshman year. We just call it first year university. And just that, we are the professionals who we want to become. So we've got that behind us, and we're already living the story we want to be in without actually having made that move yet. So I hope that makes sense.
I think that makes a lot of sense, because I'm actually thinking about a quote from Hemingway. He said in The Old Man's Sea that when luck comes, you got to be ready, right? Nothing's ever random. When you search, when you put the effort in there, you got to be ready when the right thing comes your way. So thank you ladies all so much. I know we run over time a little bit, but I think these are some really wonderful career stories. So I personally feel really blessed that we're here today to share these with over 100 people online, and we have about almost 400 people signed up. So all of you will get a recording of this today. If you have any questions, they want to reach out to us, to Willo. It's pros@willo.com. We have a website. So we actually have a brand new, fresh website that's going to come out towards the end of June. So please hang around and check out Willo. We have, just like Melissa said, we have definitely a digital footprint. Our hashtag is Let's Willows. If you search for that on Instagram, on Facebook, we're there. And last but not least, we are going to ADHA virtual this year, but we're still very excited about it. So between June 26th and 28th, we'll be at ADHA virtual. So there's still opportunities to sign up for that. We'll be at the trade show. We'll be sponsoring lectures. So please come check us out. Thank you so much, everyone. And I wish everyone gets some inspiration from all these wonderful ladies that we talked to today. And I wish you a wonderful and meaningful career search going forward. Thank you very much.
Thank you. Bye, everyone.
Bye.